I've followed her for about 1.5 years, and I want you to see how the unfolding happens and what secondary prescriptions are needed and how do we manage these, because this is critical. The first prescription is just half the job done, remember. Let's see what's happening here. So I'd seen her in July, and this is the first follow-up in September. So I've divided the follow-up symptoms into stage 1, 2, stage 3, and stage 4, so that I can understand at what stage what changes are happening. Yeah. On the mental, physical, and pathological level, what we see is there is severe acute rhinopharyngitis. She's had some strong burning and heat in her nose, eyes, and throat. She had an episode of severe pharyngitis. She had stinging tears, urine was turbid, fever. She was mentally very anxious. She was restless. Now normally she takes Kali-Bai during these episodes, and I said, we do not take anything. And then she said, I had extra systoles, but they were less frequent. So that was on the physical, pathological, and mental level. On the generals, at a deeper stage 3 holistic level, she said, I felt I was eliminating something because my general state was good in spite of this pathology. She had more energy. She was able to cope. 12 hours of intense physical work. She works at the hospital, her own hospital, with her son, who is also a doctor. And she said, my muscle aches recovered well, and I was sleeping better after that episode. And then I asked her about her dreams, and she said, I had lots of dreams. So one was this compression from all sides. There was an invisible energy that made me shrink. I was patiently waiting to decompress and enlarge. So this is the difference. She was calm. She was not in panic when she had that compression coming up. She felt that I will recover my original form if I am calm. It was strange because she was not upset. She woke up with a feeling of wonder. Another dream of being very dizzy and falling and waking up suddenly. It's all dark and she's losing balance and she's falling. One more dream of being in outer space. I was attached or holding onto an artificial satellite. It was spinning. I'm trying not to slip away. I saw darkness on one side and the sun on the other. I asked her about that spinning because I had not heard that before. She said it was like a solar explosion. The worst state was 4 years ago when I was very tired. I was pulled down. I was falling, collapsing inside myself. This is from the past. This sensation has not occurred anymore. Another dream of dancing above the earth. I was spinning on the rhythm of dance. People were amazed I could do that. I was floating, felt very light. I wished to be a ballerina in the past to express my feelings because I don't express well. So there was this very deep experience of the energy, the source coming up in the dreams. And there was a lot of positivity there because she was no longer emotionally agitated or panicked. She was, calmer. She was in a state of wonder. A lot of source states, the black hole state coming up, and the dreams where she is able to express through her dancing. So there is a positivity coming up at stage 4. And hence, we decide the remedy is still working. We wait and watch. With black hole, we don't take black hole. But she wanted something for the rhino's acute pharyngitis because that was recurrent and it stopped her in her tracks. And so at that time, I realized there was a tubercular, miasm coming up in her. And that she has multiple miasms. As you've seen, there is tubercular, there is cancer, there is syphilis. So a lot of miasms packed together in her state in the past. And this was a tubercular state. Because it was at stage 1 and 2, I used, iodine based on the miasmatic understanding at stage 2, which is based on the Kenton miasmatic understanding, iodine LM1 dose, based on the indications. Yeah. So this was all we did. we held on to the black hole. I said, take a double dilution of that only if the state relapses, right? So she comes in October now, 1 month later, and now she says, I have, at stage 1 and 2, she says my thiamazole, my antithyroid remedy, the drug is now reduced to 20 milligrams because her blood tests are better. So the results are being seen in the pathology. The endocrinologist understands she's taking homeopathic, so they're happy for her to reduce the dose. And then she said, I had very similar symptoms to when I went into menopause. I have diuresis, I have swelling in my hands and feet, my urine is very cloudy, I have vaginal pains, I have hair fall, I have ugly superficial dilated veins since then and they are enlarged. And she says, I've always had hormonal problems and I've taken progesterone injections for that. I also have a lot of hair on my body and arms. So this was the state that came up. So she was good initially, but then she got worse and she had taken black hole LM1 double dilution that we spoke about in the last follow-up. In the dreams, you had, she had some end of the world dreams. She saw a building which was in collapse, everything was shaking, and she saw her dead grandmother 20 years ago who wanted to go down the building. So she held her hand, but the grandmother unfortunately fell and she woke up screaming. And she said, it was all this energetic influences around me. I felt oscillations as if I was in cosmic darkness, as I was a part of infinity. It was a structure of nothingness. And then she showed me a picture of quantum foam. And then she started talking about stars and comets. And she says, I belong there. I don't belong here. And this sensation is now very strong than ever in the past. There was this analogy between the chakras, auras, and biological field of human anatomy that human body, that she was trying to make connections with, a lot of creativity going on in the brain. So she says, my thyroid, when it decompensates, I have collapse, I have heartbeats frantically, I'm drained of all my energy and I'm pulled down to the earth. And it was horrible in the past, but not anymore since the black hole. So the intensity of that decompensation has changed as well. And can you see, she's completely in touch with her source in the subconscious. So this is when I realized this is a good time to go up the potency. So I said, let's move from black hole LM1 to black hole LM3. And along with the same time, because now we can see a hormonal layer coming up. The tubercular layer is gone, the hormonal layer is coming up. So I decided to use a hormonal intercurrent testosterone in her 200C1 dose. Again, the symptoms are based on the symptoms that she had at stage 1. This is, these are the testosterone symptoms and a suppression that has happened since progesterone. So we have 3 female hormones, estrogen, progesterone, and testosterone. Based on the symptom pattern, you choose what hormone that you need for that patient, what sarcode they need at that stage 1 level, right? And then she came back in October. Now, this time she's reduced her antithyroid prescription to 15 milligrams now. And she says after each dose of black hole, she feels for a few days some congestion in the nose and nostrils, something is detoxing there, but otherwise and some perspiration is profuse and the urination is profuse. A lot of detox happening through her discharges, through her nose and throat, but she says, I don't have any cold and fever anymore. The acute respiratory symptoms are gone, the hormonal symptoms are also gone. So we give the 2 intercurrents, the iodine and the testosterone, and that has helped peel off those layers. Otherwise, she's well, but she says this time she can feel the digestive symptoms are worse. She's aggravated by some eggplants and butter and fat, and she's not tolerating some foods. So there is some sort of irritation in the bowels at the digestive level. She feels the bowels are overloaded with energy. And she has had a newborn grandson, and her son complained that she's not helping enough, and that really triggered her. She was depressed and crying, and she felt this heavy responsibility for her son's family, her family, and her patients, and she was trying to do too much. And she felt I was consuming all my energy, tremors in my body, and then she says maybe it's a month of astronomical phenomena. So there was a trigger, but otherwise she was okay. So we do not repeat the black hole. We used a bowel nosode this time, because this is a specific for the bowels and the symptoms that she had. So there were a few things that we took into place. We took into consideration for the bacillus dysentery. It covers the tubercular and the cancer miasm in her. It has an argentum nitricum like nervous anxiety, but it is a thyroid specific according to Dr. Gajanan's thyroid repertory. Any form of concomitant of pharyngitis with thyroid is bacillus dysentricus. So it covered a lot of different stage 1 symptoms for her through the layers. It covered the nervous anxiety, it covered the miasm, and plus it was a thyroid specific. And so this was when, this was the intercurrent that I used at that point. Next, she came in November, and that time she says, I'm very good, functionally no issues, the colds are gone, I feel less hurried, I'm less tense, and now she's much better. So she feels that I want a sense of tranquility now that she was talking about. I want to stop worrying. She's worried about her grandson, who is a newborn grandson. If he swallows, he doesn't swallow well, she's in a panic. If he's suffocating, that's the pressure I have. And there was a one-off dream of an earthquake, but it was very different. It was mild, but it's a powerful dream that she felt. But the final shock of the earthquake did not happen. She managed to get all her family around her. She could see the space was wrinkled, but she did not feel any terror. It was just a mild tachycardia when she woke up. So she's doing well at the subconscious. The black hole has really worked very well at that level. So, and we don't see any new layer coming up this time. So we just decide to continue with black hole LM3. So the next time she comes, and that is in December, she's now in thyroxol 10 milligrams. The blood tests show that she's now moving towards hyperthyroidism, which is great, because now we know she's, we have to withdraw it. So she's very cautious, but that's where it is. And again, the endocrinologist is very impressed, because the positive thyroid changes happened much faster than they had assumed. Now she has gone to party, she's danced at a party, and her muscle pains are not any more serious. The anxiety is less, the worry is not permanent. And then she can see some skin symptoms happening. The skin's cracking at the nails in the right thumb. She has a lot of old symptoms coming up, mild nose congestions, extrasystoles, but they come and they go. They come and they go. So all of them disappear within a week. So this is for me, when the skin's coming up, it is, remember, at stage 1, it is Hahnemann's Sora. So I used no black hole because nothing is happening at stage 3 and 4. She's cruising along well. I use Soranum LM1 as an intercurrent one-off. So this is the end of the game. As you can realize, this is what Hahnemann speaks about. At the end of the chronic condition, you have psoric symptoms coming up. So now she comes in January 2023, and she says the thyroxol, she's reduced to 5 milligrams. She could have very well tapered it off, but she's cautious. The endocrinologist is very happy, and they want her to continue with the homeopathics because the treatment is good. She's a bit sort of, the antibodies are still high, even though she's in a hyperthyroid state. So she's sort of cautious, but the skin's now healed. The muscle pains have gone. There is some diarrhea, but she's not had the pharyngitis again. And then she says, my gums are irritated now. Remember, she had a lot of dental work and a lot of suppression at that level, a lot of antibiotics, and she's got prosthesis. So she's now having all those gum issues coming up again. And since her 20s, she had bleeding gums and gum retraction and teeth being replaced with fake teeth. She's hair loss again. And in the dreams, suddenly she started having a dream and she had nightmares. She saw she was an angry person, crazy person, shooting. It's very strange, she said. That's horrifying facial expression. I was like a wild beast growling. My children started to run away. I was aware it was not normal, but I was upset. I was scaring them. It was beyond my control. And I have this nightly anxiety weight on my chest, and I woke with great difficulty. This is important. This is very syphilitic. And this is where I decide to use, this is Hahnemann's syphilis, right? It is at stage 1. And we decide to use Merck iodus rubor, which is also a specific, covers the thyroid state as well, LM1, 1 dose. Then I see her in March. At that time, she's reduced the thyroid to 2.5 milligrams because her blood tests are again really good. But she's now really excited because the antibodies for the Graves are now lower. And she's walking 5 kilometers. She's no problem with the muscles. She's feeling really well, no fatigues, enjoying my walking and hiking. And, she feels, probably because I've reduced my thirazole so much. So that's great. And we wait and watch, no dosing at this point. In April, she's still really good. Her expectations are going up, and which is great. This is what we want our patients to be. She says, I'm going on a holiday to Italy. I have energy and power to work. And I want to have this disease, autoimmune condition disappear forever and thyroid cured. It's like 22 years of being ill. This is for the first time. She's now hoping the antibodies will not increase again. She doesn't remember any dreams now, which is good, because a lot of detoxes happen through the dreams. In June 16/6/2023, she says, I've had my blood test, everything is perfect. I've stopped my thyroid medicine completely. And she said the Italian trip was really good. I was at seaside all the time, but I did not have any problems. She felt she might have been triggered with Italian cheese, digestive issues, but no other issues. And she continues to keep well. I've last seen her in September, last month, 2023. And we are hoping to go up to LM5 if she needs to use the black hole remedy again. But so far, so good. So hope that helped you understand how you look at how you give the best potential of the core remedy to your patient, and what to do as new layers come up, and how you create the momentum, and how you ensure your core remedy is working. And if it's stagnated, how do you unblock the layers that come up? We had in her, the first layer that came up was the tubercular layer with the acute pharyngitis. We used the iodine. Then the next layer was the hormonal layer. We used testosterone. The third layer which came up was the digestive layer, which was where we used the dysentery bacilli, which was the bowel nosode. Then came up the psoric layer, which was the sorinum, and then the syphilitic layer where we use the Merck iode. So 5 intercurrents, but in 1.5 years, or I would guess 1 year, 3 months, and that has helped just cruise the journey and help sustain the curative process in her, where she could come off the medication and resolve her Graves' hyperthyroid state. So this is the process I wanted to talk about. What is the outcome for your patient when you work in this way? Your patients love you. They take responsibility for their health. They understand and appreciate their disease and their healing journey. And they are unfolding in the direction of cure with minimal aggravations. And for patients who are new to homeopathy, this is a blessing. Now, our patient was somebody who understood homeopathy, so she took it in her stride. But even for patients who do not, you can see that they are growing and evolving and understanding their health and condition much better, and they're cooperating with you. And for you as a practitioner, you have concrete, simple steps that you can follow. You can, give them an outcome right in the first consult and give them an outcome in every consult, no matter what happens. You cannot predict their journey, but you can predict what things will come up based on the diagnosis in the first go, in the first call, and you can find remedies as you go. And then you are responsible for your own development. You can learn about these different approaches, these different remedies, these different cases. There are so many free courses available in my academy to learn how you use these remedies and how you use these approaches. And you can learn it from different teachers around the globe. So today we have so many resources at our disposals. Don't shrink away from learning and developing and expanding your approaches and your toolkit. You can choose one niche and you can build your practice within that niche or niche. But you don't have to be perfect. You don't have to use that one single simillimum, and it's not a make or break thing. There is no single point of failure. You can continue to build momentum. You can give a wrong prescription but come back, and you can ensure you can still get the patient to what they want, what they deserve, and what you deserve. Now, if you want to know more about the stages template, you can download my free book, When Your Favorite Approach Does Not Work, and you can get it from the link. And go and do the best, keep evolving, keep growing, and keep giving the best to your patients. Thank you very much.